For more, we're joined by the host of RN's Health Report and the co-host of the CoronaCast podcast, Dr. Norman Swan. Norman, thanks very much for your time. Now, to what extent are these case numbers, this 18, an accurate reflection of the real problem, do you think?
Well, if you take the cumulative case numbers, there are around about 150 to date. And we know from research done at the Kirby Institute in Sydney that we underdiagnosed by at least a factor of 3. If you go by the Australian National University's figures, we underdiagnosed by a factor of 7. Kirby Institute's probably more accurate. And so there are 450 to 500 cases out there in New South Wales, not 150.
That's a really alarming figure. Now, the Premier has said that New South Wales always acts on the precautionary principle. Does that fit with the current restrictions that have been announced?
The precautionary principle is act fast, act early, beg for forgiveness later, because there's no prizes for being late to this party. So what should be happening now? Almost certainly, because you've now got this virus seeded throughout Greater Sydney. You've got a problem in Wollongong. The numbers will go up and down. It's 5 days after Christmas, one incubation period after Christmas. So you'd expect a spike round about now. And that's a springboard for New Year's Eve as well. So the precautionary principle would be locking down Greater Sydney and really holding that for about 2 weeks and being very careful about people moving from Greater Sydney into regional New South Wales. So effectively doing what Victoria did, but doing it probably a bit earlier than Victoria did to prevent a serious second wave. And the worst that can happen here is that nothing happens. But the risk here is that it's spreading through Greater Metropolitan Sydney and Greater Sydney, and you don't know where it is, and there are clusters that you may not have identified. And this Croydon cluster, from what we can hear, was of the very generous actions of a person coming forward for testing, and people are being fantastic in the community about this in the Northern Beaches, but it needs to spread. So mandating masks, lockdown, and the other thing that needs to be considered is the Sydney test. In the current environment, it really is not good public health to continue with the Sydney test. Yes, it's outdoors, but there are choke points. People are travelling by train and bus to get there. You've got to go through narrow turnstiles, and we're not mandating masks even in that situation. So I think that the Sydney test should go ahead, but without spectators. I mean, that would be the precautionary principle, not what's going on now. Because if you've seen what went on in Victoria with the trying to ring fence 36 suburbs, what's gone on overseas in countries like Israel, the UK, and the United States, half-hearted measures don't necessarily work. We've been relying in New South Wales on the absolute fantastic work of the contact tracers. It is truly amazing. They're working incredibly hard. It's to the great credit of everybody, including New South Wales, that they've got that system going, but it won't take long for that to be overwhelmed.
There's no doubt that we have had in New South Wales a sense of security when these numbers have remained in single digits, and then to all of a sudden see them jump to 18 today, I think will alarm a lot of people. Yes,
I mean, the contrary argument is that it's still single digits outside Northern Beaches, but single digits become double digits, become triple digits. It doesn't take long for this to spread. Increased testing does make a difference. Contact tracing definitely makes a difference. But getting this back down, and there's the current environment in Australia is the internal borders won't open up unless Sydney and New South Wales gets down to zero spread for quite a number of days.
What about ring fencing Greater Sydney, as they did in Melbourne, travel to regions being prohibited?
Well, I think that would be part of a lockdown. It may be unnecessary to set police up at roadblocks on the Great Western Highway, but if you just locked down and restricted people's mobility, then that in effect is what you would do. People would not be allowed to travel, and you could have spot checks. I mean, this is not easy, although paradoxically it's slightly easier at this time of year because business is not in full flight. But for modelling at Sydney University by Professor Mikhail Prokopenko has shown that for every day you delay going into lockdown, and lockdown is really the only thing that works when contact tracing has failed, is a week at the other end in terms of getting it back under control. And that means we stretch into when business is getting back to business in New South Wales. Now is the time to lock down when people are on holiday.
With this increasingly concerning situation in New South Wales, is there any argument for a rollout of the vaccine in Australia to be accelerated?
Well, certainly a rollout when you've got clusters like this. The answer is yes. It looks as though there's good news about the Astra vaccine. We are producing the vaccine. We must have doses ready to go. And what you would do is that you would immunise, say, healthcare workers in Wollongong, on the northern beaches, maybe in central Sydney, aged care facilities, so that people can start visiting more safely because people are not going to get serious disease. And then you might consider a program called ring vaccination, where you actually vaccinate people in a ring around contacts. So say the Croydon cluster, everybody you know that they've come in contact with, you'd immediately start immunising them in the hope that that would reduce transmission. There's no proof of that yet, but in this situation, if it's safe and could be effective, it's something that you would do. So you would roll out the vaccine now in New South Wales, which means getting the Therapeutic Goods Administration to accelerate approval. There'll be approval by the end of this week, probably in the United Kingdom for the Astra vaccine. We could do it too.
We've seen the Premier announce new restrictions in aged care facilities, as well as part of today's announcement, no visitors unless it's in terms of an end-of-life situation. And I guess all of this also comes at the same time as we're watching this terrible situation, both in the United States and the UK. Yes.
So if you accelerated the vaccine, rolled that out to aged care across Greater Sydney, then people could visit quite safely, because even if they brought the COVID virus into the aged care facility, their loved ones would be safe from serious disease. So the holding back till March is not a sensible policy at the moment, and they should have enough vaccine sitting in CSL in Melbourne ready to go. They've been manufacturing this now for some time.
Dr. Norman Swan, thanks very much for your time.
You're welcome.